Probably the most painful condition we'll see in the office and the most scary is that of a disc issue. And we need to use a proper examination to differentiate, is it a disc herniation versus what we call a disc torsion. Now, a severe disc herniation that's going to require surgery is definitely going to get referred out at the office, and I refer out people almost every day for these conditions. But in my opinion, the majority of these conditions are a very low-grade disc herniation, or what I would refer to as a disc torsion, where the body's getting twisted and it's almost like wringing out a dish rag. There's small little tears in the disc fibers. Now that's going to cause a lot of inflammation, but it's going to cause a severe muscle spasm that goes up and down the back. The muscle spasm, in my opinion, is most often mistreated, and I'm talking every type of therapist out there. Chiropractors, in my opinion, do a poor job a lot of times. The physical therapists, the medical doctors, we tend to look at that tight muscle and want to try to relax it. Let's stretch it, let's put heat packs on it, and I really disagree. Most of the time, a disc torsion we can take care of in 3 to 4 visits over the course of 2 weeks. And this is one of those that if it doesn't respond very quickly to treatment within 1 to 2 weeks, we get them out the door and get the MRIs to make sure we know what we're dealing with. But what will happen is the muscle spasm will contract and make the pelvis come up, the thoracic spine come down. So when we do the chiropractic adjustments, we move very quickly to bring the pelvis back to where I'll typically use a drop piece table. This table pops up, it pops down. That way I can move the lower back without having to put a twisting mechanism in it, which is most often what injured it in the first place. We want to minimize that. I'll also adjust this upper area in order to relax the tight muscles. Again, the muscles are secondary to this condition, so I immediately get the patient back up and we get the ice pack on them. I wanted them in a seated position. You guys that have gone through the disc issues before, you know it. The changes in position are what's the most painful, specifically after waking up first thing in the morning and laying down. You no longer have gravity compressing those discs when you're laying there, and when you get back up, it's a reload of pressure. That's the most painful. Don't let the pain scare you. It's still very treatable and easy to take care of. You just have to have this explained. I've got a link on my website to the disc injuries and the disc torsion, and should explain it very well.